Sean, pregnancy comes with its own set of concerns and risks. And the High Risk Pregnancy Center right here in Las Vegas has been helping women, their unborn children, their husbands like you. I know you and Marcia went there during her last pregnancy to stay safe and secure, even in this time of a global pandemic.
Oh, fun times. Money J. Cami, our MD,
Yeah.
she is here to help us kind of navigate pregnancy during coronavirus. Oh, my goodness. Money J, it's great having you. Thank you for joining us.
Thanks for having me.
All right, so let's talk about this. Pregnant women and coronavirus. Is there a higher risk for pregnant women of getting coronavirus or no?
There's not a higher risk of actually being infected with the virus, but there is a higher risk of having some more severe complications if you are infected with the virus. So that's the bigger concern with pregnancy.
Yeah.
Interesting. I just know that you are getting a laundry list of questions because, of course, you are seeing patients right now. Tell me some of the main concerns you hear coming from expecting mothers.
Some of the biggest ones are what they can and can't do. So, can I go to the grocery store? Can I go to work? What should I do when I do those things? And my job is to teach patients how they can protect themselves from coronavirus and what they can do to keep their day-to-day life as safe as possible with during this global pandemic.
Believe it or not, back in Boston, I have a cousin who was pregnant that got coronavirus pretty early on in this
Oh,
situation
wow.
here. So heaven forbid you are a pregnant woman, you do get coronavirus. What should you know?
Right. So, number one, I think it's really important to know some of the signs and symptoms. So, those are everywhere. They're all over the news. They're on the CDC website. So, just make sure you know them because if you do start to exhibit signs, whether they're mild or severe, it's really important to go get tested.
Yeah.
And then, if you're pregnant, it really depends on what gestational age you're at. But, you're going to probably have a high risk OB doctor involved in your care. You're going to probably require a few more ultrasounds during your pregnancy. And the biggest thing is really to make sure that you and your baby are safe. So if you're having some of those severe symptoms, you present to the hospital so that we can take the best care of you possible.
Gotcha.
Yeah, boy, it is really a scary time, isn't it? So if you're a pregnant woman and you have not contracted COVID, what are the set of recommendations that you're telling people, how should they go about their daily lives? You mentioned, should people be going to work or not, which,
Mhm.
quite frankly, isn't really a choice for people. Do you have any advice?
Right. So, you have to do your normal things, right? People still have to get their groceries. They still have to go to their doctor's appointments. They still have to take care of their children and go to work. So it's really the same recommendations we have for the general public. That's what we want women to do. So all those things that we talk about, like masks and social distancing, those work, but you have to do them all the time.
Yeah.
Washing your hands for at least 20 seconds or using some sort of alcohol-based solution for until your hands are dry, before you put anything in your mouth, avoiding touching your hands to your face or to your mouth without washing them as much as possible. If you do all those things, even if you're at work, even if you're at the grocery store, you're really going to limit your chances of getting this virus. And that's the same for pregnancy. That's the same for non-pregnant patients. And that's what we recommend.
Worth noting, though, you do not take non-pregnant patients. You are taking pregnant patients at High Risk Pregnancy Center. It's kind of your
We
thing.
only take pregnant patients, and we help their husbands and their children usually as well to
I
kind of
made the
give some
trip several
guidelines.
times. No question. No.
Yeah.
So let's talk about the services that you do provide, whether you do or don't have COVID, the services you provide to pregnant women throughout the Valley.
Right. So we perform ultrasounds here in our office. We do consultations pre-pregnancy and then especially during pregnancy. We help you work with your OB doctor to manage your pregnancy throughout from the beginning all the way to the end. We perform genetic counseling, diabetes management, high blood pressure management. So this whole variety of conditions you can have when you're pregnant, we help take care of all of it.
Yes, you guys do it all. That is awesome. And I believe you're at the Pinto location this morning, but you have more than one location here in the Valley?
We do. We do. We have a location here, kind of close to the 95 in Rancho. We also have a location in the Summerlin area at the what we call our Post Road office, and then we have a location out in Henderson.
Awesome. Well, it's great work that you do, and we had a great experience there, and we appreciate the work that you do and continue to do. Thank you so much, Doctor. Great to have you.
Thank you, Doctor.
Thank you very much. Thank you.
All right, if you want to learn more about High Risk Pregnancy Center, you can go to hrpregnancy.com to visit one of their 3 locations throughout the valley. You can also call the number you see right there on your screen. High Risk Pregnancy Center, a proud sponsor of the Morning Blend.